Hello, everyone. My name is Roslyn Douglas with Central Health Grenada. During the month of October, we have a series entitled Grief, Grenada, and COVID. My guest today is Dr. Augustine Panchoo, who is more than qualified to tell us how we can deal with grief. Dr. Panchoo, many people think post-traumatic stress is limited to persons who have been deployed in the military and they come back and they have a lot of trauma to deal with. But research shows that individuals who have encountered grief, who have lost someone suddenly, any type of traumatic issue, also suffer from post-traumatic stress. Can you explain post-traumatic stress and how a person can cope?
Post-traumatic stress, or PTSD as we know it, is really the body's and the mind response to a traumatic event. That's what it is. When you look at the history of it, started with clinicians and psychologists studying people who came from war. So that's the genesis of PTSD. But the research now shows that many instances of people who have suffered loss or threats, in fact, just even threats of loss, witnessing a traumatic event, like many who saw the falling of the Twin Towers, or many who experienced Katrina or Ivan in Grenada. In fact, one of my dissertations was actually on the traumatic responses of Grenadian school children after Hurricane Ivan. And so when a person feels threatened with a sense of urgency, whether it is threat of life, threat of hurt, physical harm. So for example, let's make it really simple. In cases of domestic violence, intimate partner violence, that doesn't involve death, just the threat and the knowledge of an abuser coming home or coming to your office and inflicting, whether it is verbal, psychological, or sexual or physical threat, harm to your body. If it is done in enough of a traumatic way, and if the body perceives it as enough of a threat, you can develop PTSD, you can develop post-traumatic stress disorder.
So it's the way how does that connect now to death? Are you saying that the body recognizes the trauma of death as something that it needs to protect itself from?
Yes, absolutely, because here is what happens in the mind. When we lose a loved one, the mind goes to the loss. So the body responds to the loss. Remember, the grieving process. So that's where we come in and we talk about the grieving process for loss of loved ones. In fact, watch this. We can develop PTSD even from a family member who have contracted a terminal illness. That is even before the person loses his or her life. Cancer patient, AIDS patient. As you work with the family member and you see the turmoil, you see the emaciated body, as you see the hurt, the helplessness, like a stroke victim that is totally bedridden, and you have to do so many things for that person. And your let's say it's your mom or your dad or whomever it is, you see them with bed sores. And I'm going to get a little graphic here because I want our audience to grasp how PTSD develops. So as you look at a person who has moved from full ambulatory status, from full mobility to being bedridden, where you have to do everything for that person, it can trigger grief in you. And that grief, if it's sufficient enough and the way your body and your mind perceives it and interprets it, can lead to post-traumatic stress.
So how can a person cope then? How can a person cope?
Very, very, very good question. Because You know, trauma, PTSD, is a combination of two major mental health deficits: depression and anxiety. So when somebody has PTSD, you can expect that that person is going to be anxious, or they have anxiety in their life, and they have depression in their life. So those two mental health challenges interplay. Sometimes the anxiety overrides the depression, or sometimes the depression supersedes the anxiety, or sometimes there is just an intricate balance between the two, anxiety and depression. And so I want to talk quickly, before I talk about the coping skills, I want to introduce how we recognize PTSD in people.
Okay.
That even a lay person can say, you know what, maybe that person is suffering from PTSD. One, does that person have intrusive thought? In other words, so since we're talking about death, the question is on death, you may ask, during the daytime, out of the blue, does that person talk about death? Do they talk about the funeral of the loved one? It could be that that person, you know, normal conversation, maybe at the dinner table, watching a movie. If the person goes away, breaks down and starts crying, that's what we call intrusive thought. So it is possible for you to have to have what is called intrusive thought. Then the second thing is flashbacks. Do you wake up at night crying because your uncle got buried and he was affected by COVID, maybe COVID positive, and you wake up in the night now with tears in your eyes, unexplained? Or sometimes you can make the connection, but the interesting thing is that it is possible for you to wake up and be crying, or to be awake in the midst of people or alone and shedding tears, and you just can't figure out where they are coming from. The other thing is hypersensitivity. Hypersensitivity, you may smell something that, like someone cooking. For example, let's say it's your mom. Watch this, how beautiful this is. Let's say your mom has a favorite way of cooking rice and peas or chicken or whatever it is. And you walk into a house, or the house or your house, and the flavor resembles close to what mom used to do. Immediately, your mind and your body goes into panic, because you're thinking, is she here? And you can have a hypersensitive reaction. And the last thing is, the last point I want to rest assured about to recognizing PTSD is that of avoidance, avoiding things you used to do with a loved one. So if you and your dad used to really hang out, and you guys used to go to a particular place, maybe the beach, or maybe to a store, or maybe just in the backyard doing stuff, all of a sudden, you no longer want to do that, because the mind is saying, I cannot cope. I don't know what to do. I don't know how to embrace this new thing that is happening with me. And so that leads me now to addressing, how do people cope?
How?
Here is where the psychology of coping comes in. And I want to lead maybe about 3 or 4 little items quickly, so that we can help. I'm, let me say this here, dealing and addressing post-traumatic stress disorder is a very lengthy process. This is not one of the mental health challenges that you can do in a 2-session or 3-session. This is a lengthy, elaborate process where the clinician, the psychologist, or the counselor who is trained in PTSD will guide you through several sessions of bringing you back and grounding you. So the first thing I like to say is, we teach people how to do what is called mindfulness. Mindfulness is a simpler way of saying, focus on the present, on the now, on the awareness that you are surrounded with. Do not worry about the yesterday, okay? Kind of hard to do, because you have the memories, right? And sometimes the flashback comes and it's unavoidable. You really can't do anything with it but to deal with it, whether you break down or you cry out or you look for an alternative way to deal with the thought. So mindfulness means I am present. I am not thinking of the past, and I'm certainly not thinking about the future. So one of the things is to be mindful of the present. And then the next thing is what we call teaching people to do grounding skills. Grounding skills refer to things like deep relaxation, maybe deep breathing, looking for activities that will swiftly take your mind off the intrusion or the flashback, where you can do creative things. So that grounding skills here teaches us to be able to tap into the creativity of the human being. And that's a really great way to deal with how we cope with PTSD.
Mm-hmm.
Then the third thing I want to introduce is looking for a support group. For post-traumatic stress, one of the greatest way to recover is to hang out with, to form an alliance with people who have gone this way before or who are currently dealing with death in the family or some kind of trauma in the family. And here is one recommendation I have for the fourth thing is get a pet. You know?
A pet?
Yes, get a pet. Post-traumatic stress and pet. People, I mean, you know, we get a dog and we say it's a pet. You know, Grenadians, we really don't connect at the emotional level. So what I'm talking about here is get a pet that you can connect to at the emotional level. And maybe that's one of the things we need to do in Grenada, you know, is to teach people how to get connected, whether it is a horse or a donkey or a dog or a cat, how to connect with it. We call it in therapy sometimes, you know, equine therapy. Like if, you know, the large animals like horses and donkeys and even oxes and stuff, but we can connect to animals at different levels, and that can help us deal with the trauma. Because animals, watch this, animals are relentlessly loving, and they do not know how to hold grudges. So an animal is always stuck in mindfulness, in the present. And if you can learn with and for with together with animals, that will be a good coping strategy.